Is a lung and a critical care specialist. As the Chief Medical Officer of the United Memorial Medical Center in Houston, Texas, he is at the forefront of battling the coronavirus. Now, the medical staff in his hospital are overwhelmed. There is a steady stream of patients infected by the coronavirus who are flooding into his hospital every day. On an average, he individually tends to at least about 40 people who've been infected by the coronavirus. But the doctor insists that fighting the COVID-19 pandemic is a two-frontal war. Now, one part of the fight is against the virus, which he feels is the easier one, while the other one is against people's stupidity, who continue to roam the streets without wearing masks or adhering to social distancing.
Yeah, and the thing is that she was taking care.
Yeah, my motto has been, at the present time, I'm pretty much fighting two wars. A war against COVID and a war against stupidity. And the problem is that the first one, I have some hope about winning, but the second one is becoming more and more difficult to treat. And why do I say that? Because people are not listening. Whether it's, we're backed up by science or just plain old common sense, people are not listening throughout the country.
Now, the medical staff in the hospital since the beginning of the pandemic have witnessed mass casualty in the wards. Dr. Varon has been a frontline responder in other natural calamities, but has never witnessed such a laid-back and irresponsible attitude on the part of the general public.
It's interesting because, I have been in the middle of earthquakes, in the middle of bombings, in the middle of tsunamis. I've been in every possible catastrophe that you can imagine. And by far, this is the worst. And this is the worst because this is a continuous situation. The other ones, something bad happens and then you run, you take care of things, and that's it. Here, continues to occur. And what is probably the most disappointing thing, the thing that annoys me the most, is that we keep on doing our best to save all these people, and then you get another batch of people that are doing exactly the opposite of what you are telling them not to do.
With more than 150,000 dead, the United States has been in the grip of the COVID-19 pandemic for several months, and there is no sign of the virus crisis abating. And many healthcare workers and frontline medical staff are now falling prey to the virus.
I worked this past Wednesday.
Oh, wow.
I had 3 patients. I wasn't feeling too good towards the end of the shift, so I let Dr. Varon know. And he was like, you need to get to the ER. And they told me I was positive. And that's the hardest thing to ever hear, is that you're positive, because then you're in your mind going, where did I go wrong? What did I do wrong? Because this is what I wear. So it messes with you.
Now, Christian Mathis is not alone. There are many other medical staff at the United Memorial Center in Houston, Texas, who require nasal tubes with oxygen to help them breathe. Now, Texas, along with California and Florida, has emerged as one of the new national hotspots. So far in July, the number of cases in the state had doubled to more than 400,000 in total, and deaths have risen by about 32% in just the last week. Meanwhile,